Your surgical team will have told you when to stop eating and drinking before your operation. This includes chewing gum and smoking. This is normally 6 hours before your surgery takes place. You can brush your teeth before your surgery, but make sure you spit out the water. If your surgery is planned for the morning, think about having a light meal or snack in the late evening on the day before. For afternoon operations, you can have a light breakfast in the morning. Please check beforehand with your anesthesia team. It's a good idea to eat food that release energy slowly so that you won't feel too hungry. Things like fruit and muesli are ideal. Your care team may also recommend certain foods or drinks. Make sure you follow their advice. You will be asked to take a bath or shower on the morning of your operation. You may need to use a special antibacterial product. If not, you can just use normal soap or shower gel. Wash your hair with shampoo or any products that your care team give to you. Use a clean towel to get dry and put on clean clothes or nightwear afterwards. Take off any jewelry and remove all piercings, nail varnish and false nails before you have a bath or shower. After your bath or shower, don't put on any makeup or apply creams or lotions unless your care team has asked you to do so. On the day of the operation, you should arrive at the hospital at least 2 hours prior to your designated surgery time. You might be admitted onto a ward or shown to a shared or private room. Some hospitals admit patients the evening before their surgery. Note that surgery schedules can always change at the last minute due to emergencies, so do not be upset if your surgery takes place later than you expected. If this happens, you will be taken care of by the care team on the surgical unit. Once your surgery is confirmed, medical and administrative staff will carry out all the necessary formalities to prepare you for the operation. They will be available to explain everything you need to do and how you should prepare to travel to the anesthesia suite and operating theatre. The staff do this with patients every day, so they will be able to answer the questions that you might have. When you go into hospital, your care team will assess you to make sure you're ready and well enough for surgery. If not already done, you may also be asked to sign a surgical consent form. Your anaesthetist will explain how the anaesthetic will be given to you. Thyroid surgery is usually performed under general anesthesia. A general anesthetic means that you are completely asleep during all of the operation. Therefore, once as you fall asleep and until you are fully awake again, your vital functions like heart rate and breathing will be constantly monitored by your anaesthetist and the care team in the recovery room. When the time comes for your operation, you'll be asked to put on a hospital gown. You may walk to the operating theatre, or you may be taken there on a trolley or in a wheelchair by a porter. Your surgical team will be waiting for you, and you may be asked to identify yourself before the anaesthetist puts you to sleep. Your anaesthetic will be given by an injection or by a gas that you breathe in through a special mask. Thyroidectomy surgery usually takes 1 to 2 hours, depending on the type of operation. Once the operation is over, you will be taken to the recovery room where you will be monitored whilst being allowed to wake up. After surgery, you will be placed in a recovery area where the nurses can monitor you closely until you are fully awake. Once you've started to wake up and your care team are happy with your condition, you will be taken back up to your room or to the ward. If you feel well enough, you can eat a light snack and have a drink of water a few hours after your operation. However, you may not feel like eating or drinking, and it is also common to feel sick or actually vomit after having a general anesthetic, so don't worry if you want to wait for a while. You may discover you have stitches, small surgical plasters, often called steri-strips, or even a line of surgical glue on the wound at the incision site, which will either dissolve over the next few weeks or be removed by your care team once the wound has healed sufficiently. To evacuate residual blood or other fluid, a thin plastic tube is sometimes inserted into the wound site. This drain is usually removed the morning after surgery. Its removal should not be painful. After your surgery, you will probably be in some pain. This is usually effectively controlled with small doses of painkillers that will be prescribed to you by your surgeon. It is very common to have a sore throat, difficulty swallowing, or a hoarse voice, and these things normally get better after a few days. You may notice some changes to your voice. Your doctor may use a laryngoscope to examine your vocal cords and to make sure they are working correctly. Hoarseness and voice problems are very common, although they should only last for a few days. They are usually because of the tube placed through your larynx to keep your airways open, intubation, during the operation. Your healthcare team will request you to move normally after the surgery. It is quite usual in the case of thyroidectomy to stay in hospital overnight and be discharged the day following the surgery. Some procedures can be done on the same day as day surgery, but in other cases you may have to stay in hospital for longer. Your surgeon will advise you. At discharge, you may be given some prescriptions for painkillers, thyroid hormone replacement medication, and/or calcium supplements. Sometimes you may also need to take a course of antibiotics. It is important that you organise in advance how you will get home or who will collect you from hospital. You will not be able to drive for at least the first week after your surgery because you will not be able to turn your head comfortably. Your medical team will arrange an appointment for you to have any stitches removed.